again, the biggest thing I could tell people is the setting and where you get. And I'm not saying it just because I'm a pharmacist and I own a pharmacy. That's not it. That is what I know best and where my passion lies. But it is important that people treat this as a medicinal item. And I think they should discuss it with their doctor. I think they should find out if that's something that would be a benefit for them. Then they can come in and see me, sit down. I'm very fortunate. I have 3 other pharmacists besides myself. So when you come in to see me, I'm not always behind the counter, I have a desk out front. You sit down, we'll talk about it's for you. And there's some people I'd say that's not going to help you for what you're looking for. We get people that come in. I had a lady come in who wanted to find out if she could put the CBD oil in her ear for ringing of the ears. And I said, no, that's not where I would go with that. But I do get all kinds of questions, and I tell them up front, so listen, this is not, I don't think that's going to help you. I don't want you wasting your time or money or getting yourself in another situation. But it does have a good use. I think if the other thing we were going to talk about was the reason I think it's important to talk with your doctor and your pharmacist is there are a number of medications, or at least classes of medications, that are, can interact with a CBD product. Not so much topically. You don't really see it much with that, but an oral product, there's certain blood thinners on the market that the way CBD works is it inhibits the metabolic pathway that drugs are broken down in the body. And so, for example, if you're taking a CBD product and you're taking, say, Coumadin, a blood thinner, or warfarin, that's going to slow down how fast your body breaks that drug down. And that doesn't mean you can't use either one of those or together. We need to know about it. We need your doctor that does your testing needs to know about it. We need to know about it, and we can work through that. But that's something that, I cringe sometimes when I think about, an elderly patient who somebody hears about it and they get something off the internet or bring it over to them and nobody's checking that. I mean, it can have some devastating results. And what we do is when a patient comes to me to get a CBD product, we have a notes field in their chart in our system, and we put down what we gave them, the dose and when, as far as a note of record keeping. And that way, if they're routinely getting something, because we have free delivery for CBD products as well, we want to know what that is. And although it's not a prescription, it's something that we need to kind of keep track of. So if they have an issue, we can give the physician the full picture of what they're taking.